I am strong. I am resilient and I am capable.
I am lover of histories. I am lover of languages.
I am capable.
I am passionate.
I'm a woman and I'm proud.
I am part of the medical devices lab at UCT. I'm very, very proud to be part of a community where there are women that are flourishing and assisting in the fight against COVID. Open Air is UCT's low-cost, simple solution to the ventilator problem. COVID-19 targets the respiratory system, and it has been shown that oxygen therapy and high-flow therapy is what is helping patients at the moment. So that is what our device does.
When I moved down to UCT, I was introduced to the program that there was a program that the MMRU was running, and it got me into the field of infectious diseases, and it opened up a whole new other aspect of how the issues of health affect specifically impoverished communities. And what I wanted to do was continue throughout my academic career. I'd always focused on issues around young people, or how young people understand issues around health and their bodies. So when I found the It Was a project, it was such a great merger of these two issues that I was really interested in, and it's continued to grow as a passion from there. What the COVID pandemic really did when it blew up in our country is reveal the fault lines, the really social aspects of health. You'll see that with the work that It Was has been doing and the many video productions that they've put out, it's really been about trying to understand how this disease is really shaping behaviors in burden settings, particularly like Kailicha, how it's challenging the social welfare issues within the township. It's not just about providing the treatment, it's also about treating the social ills that exist within people's communities around these diseases, and trying to understand how they themselves are navigating these spaces and this new way of existing now.
I've been working on various projects. One of them is the Global Rheumatology Alliance, to try and gather as much data as we can about how COVID affects patients with rheumatic diseases quite early on. We've also been very closely tracking the story about hydroxychloroquine. Our patients with lupus take hydroxychloroquine, so we were concerned early on with those data that showed questionable effects. In addition, we're starting to see cases of a Kawasaki-like disease that are occurring in children, and we're working both locally and nationally and globally to try and track these cases, treat these children, find out what's the best treatment for them. And we're also, part of my previous work was to look at sex differences in the immune system. And we've been gathering data from across the world to show how men and women are affected differently by COVID-19. I feel it's important for women to spearhead research in this context. There's important questions to be answered, and those have to be done quickly. And it's been a particularly challenging time, especially for women. And I feel like women need more support within this field to be able to carry on doing the work that they're doing.
My research is on the South African farm novel, and I'm looking at the way in which the farm novel as a genre is constructed and constructs an idea of white indigeneity. The structure of the world as we know it right now is such that a disease like COVID-19 affects hugely the poor and Black, and by Black I mean non-white, everybody. So then it's not just about COVID-19. COVID-19 is reflecting, is throwing into sharp relief these things that everybody is already studying. It really just enhanced the necessity for the work that we're doing in terms of like bringing to light how violence works. Because you think you're all in this together, and then you begin to recognize, as COVID has shown us, that actually the people who cannot afford, have not been able to afford, and will probably never afford, are the ones who suffer most from this disease.
As part of the task team, we have worked on a number of projects throughout the duration that the pandemic has been at its most serious. I was the lead engineer on the Ear Saver project. So the UCT Ear Saver, which we have now dubbed the UCT Hero, is a device which is used to attach or anchor the mask to the face without requiring the ear loops or the elastic of the mask to put pressure on the ears. The Ear Saver project for me was a nice way to provide not necessarily a medical device, but an ancillary device that, through its simplicity and through sort of effective design of it, can make a really big difference to individuals who are required to wear face masks for long periods of day. I think that Women's Day is a nice time, and especially through this initiative, it has been a very valuable experience for me to reflect on the effect that, or the influence that I can have as a woman in my field.
There are issues affecting women that we don't always take into account. And I think that it's an important thing to do, to really focus on that and focus on the stories of women and the unique challenges of women.
It is a moment to state that society can't move, can't function, can't be efficient and effective for all individuals within it without us.
It's a celebration, Women's Day, but it's also sort of an acknowledgement about how far we still have to push to get the recognition that we deserve.
Even as the world does everything to kill us, we thrive because we are not of this bloody world. And we are not limited to its violence. We are not limited to its contempt for us, that we do the things.